Good morning, John.
Hey, good morning, John. How are you, sir?
I'm doing great. I cannot believe it's the middle of November. I can't believe it's our episode 16. Time has flown this year.
Episode 16, and next week is one of my favorite holidays, John. You know what next week is?
It is Thanksgiving, and it's one of my favorite, too. That's why I look this way. I think it's Thanksgiving every week.
Yeah, I'm working out extra hard this week because I'm ready for some turkey.
I hear
Hey,
you.
John,
Well,
who do we
speaking
have
about
on today?
working out. Go ahead.
Sorry, speaking of working out, what?
No, I would say, speaking of working out, let's talk about healthcare. Let's talk about health, right?
It's a perfect topic, and we've got a great guest today, Yvonne Durbak from the CIO of BronxCare. And I think this is amazing. It's the largest voluntary, non-for-profit hospital in the Bronx area, servicing that community. So it's a big organization. There's a lot to take care of there.
There is, and I hear that they serve over 500,000 people. So with that, let's bring Yvonne on. Welcome to the show, Yvonne.
Good morning. Happy to be here, folks.
Good morning. Thanks you so much for
on.
being here today. So you've been with BronxCare for 16 years, right?
Yes, I have.
Wow.
Very happy to be here.
Wow, that's awesome. That's a long time. That's a long time.
From a technology perspective, when you think about it, what's changed over that 16 years? And then certainly we'll get to COVID. But, you know, what's been some of the dramatic changes from a technology perspective in the world of healthcare?
Well, from a national and even a world perspective, if you go back, 8, 9, 10 years, you walk into a hospital, everything was on paper. So we just moved to these electronic medical records, or EMRs we call them, in the last 5 to 10 years. So 10 years ago, everything was paper. We were way behind all the other niche industries. You know, the financial world was doing computerization 40, 50 years ago. Not us healthcare, doctors, nurses, everything jotting down on pieces of paper. And now you walk into a hospital, a doctor's office, you rarely see paper, So, and that's a huge shift.
So it's called an EMR, electronic medical record. And are you using that at BronxCare? I mean, tell us a little bit about that.
Yes, we are. We actually started our journey. As soon as I got here and I saw what was happening, and also frankly, from the point of view, because of the kind of hospital we are, we're known as a patient safety net hospital. So most of our patients are Medicaid patients here or charity care patients. Bottom line is that you don't have a lot of money, and we're non-government. We're not-for-profit, private, non-government-ish. So financial constraints are huge for us, and I saw directly that bringing in automation would make us more efficient. It could save us money and still provide even better, the highest quality of care. So we actually jumped on that bandwagon of an electronic medical record before many, many other hospitals, driven by the need for efficiency.
And how was that change accepted by the medical community in your complex?
Initially, they hated it because
it's different, right? It was different.
Different. Before they had a very efficient system going back, how many thousands of years, where they would just quickly jot down notes, sometimes in longhand, and oftentimes in longhand, in a way that frankly was sometimes non-decipherable, and that's a problem, here. But it was very efficient. The doctor's thumb would go through the medical record, 100 pages, and find the lab test that they need. It was remarkable. So they had a fairly efficient paper-driven system that they're used to for a long, long time. In comes technology. Now they got to sit down and type into that largely. And they say, "Whoa! I didn't go to medical school to become a typist." So and that became a whole. So the journey to the EMR has not been very popular with many, if not most of the doctors and nurses. So and it's still an ongoing challenge, frankly.
John, that reminds me a lot of even some of the stuff that we do at ISG with regards to organizational change management. It's not easy just taking a system that's been used, in Yvonne's example, 1,000 years and moving it to electronic. It's a change for people, It's
a huge change. And I would venture to say that that's probably 99% of the challenge. It's not really the technology. It's really not the initiative and the time and money it takes and resources to get it done. It's actually the adoption of it, right? And people feeling good about it. But obviously, it sounds like it's moving in the right direction, though, right, Yvonne?
Oh, yes. I think virtually every hospital now has an electronic medical record system. The benefits in patient care and patient safety, having everything electronically documented, available to everybody, is such an overwhelming positive factor that nobody's going to stay away. But how we've entered into it and how we've especially forcing our doctors and nurses now to document everything. And you can imagine income, legal, and compliance folks, and they say, well, as long as the doctor is documenting what's going on with that patient, why not ask also, is there any conditions at home? Are there violence situations? Have you had so a lot more? So the doctor winds up now spending a tremendous amount of time. They would complain to me earlier. They say, Yvonne, because of you, they personalize this a lot. Because of you, I'm staying in the office 2 hours longer every day because now I got to document everything. Wow. Not just pieces of paper. Here, and that's serious.
And I was going to ask you mentioned people typing things in. Is there any technology that helps people sort of dictate and then it transfers it over to text and stuff? And
yes, we have, but we've had to be very careful because even though the dictation accuracy now is at like 99%, but it's not 100%. And what if the computer misses the word "not"? Imagine some of those things here. And physicians, busy. I mean, they're under such stress. I feel for them tremendously, which is why I like trying to help them, because they're under enormous stress. They got an insurance company. You got to see your 30 or 40 or 50 patients every day. You got to get through. You have to document everything. And, you have to also take care of all these other issues here. And the doctor is heavily stressed out. Any physician conference, virtual or not, there's always a big session devoted to physician burnout.
Yeah.
And that's the telling sign. And the other issue that, I must say that the doctors really don't like is that because they got a document, they say, well, I'm going to forget. So I'll document while the patient is in the office. Okay, because that's best. It's fresh. The patient just said that they have a hematoma on the left toe. So I'll buy the computer now. But think of what happens then. The doctor sometimes turns her back to the patient and is typing into the computer. And I'm sure the patient is sitting there saying, wait a minute, I drove all the way here. I sat in the waiting room for an hour and I'm watching the backside of the doctor. This is not good. We've, unfortunately, EMR, it has hurt the patient-physician relationship. The eye contact is not there. So you lose the eye contact. The patient wants eye contact. But there's technology and it's coming, but it's moving so slowly. It has me very, frankly, frustrated. Conversational AI, artificial intelligence applied to conversation. If you can imagine, in the typical doctor's office, you have the patient, you have the doctor, you may have a caregiver also, could be a granddaughter or so in there. Well, the computer can tell who's speaking from among these three people. The computer can document this. The computer should be able to save that. So let the physician look at the patient, maintain the eye contact the whole time. That's the technology. It's coming. It's not there yet. I can't wait.
Wow. And I have another question before we get off of that piece of technology. So you talked about EMR, but are you also using some leading edge technology during procedures? I mean, like, technology aided procedures?
Robots. So tell me, so now when a patient comes in to get a hip replacement, that patient, we bring a robot to score. The robot takes the appropriate CAT scans, MRIs.
Oh, wow.
Ships that up in the cloud they analyze it to figure out the minimal amount of cutting that they have to do. And then that comes back and it assists the orthopedic surgeon to replace that hip with minimal invasion. That's happening now across the board. And we have some of the most modern. Yes.
That technology requires a tremendous amount of connectivity. So what do you do to make sure that the hospital's properly connected? Are you utilizing edge technology yet, or what are you doing from that perspective?
Well, you're absolutely right. Huge networks, because these, MRI CAT scan images, they're huge. They're gigabytes and gigabytes. So we had to, massive upgrades in the network. I'm banging on the door of my CEO and then the board and saying, you got to give us more resources because we have to bring this technology. Look at the kind of hospital. We have to be more efficient. We have to enable our physicians to be efficient, and our nurses. And that's a constant battle. But yes, we brought in lots and lots of technology over these 16 years, and especially over about the last 5, to make this electronic medical record work for the doctor, work for the nurse, and above all, to give good, high-quality patient care.
That's awesome.
And you have to have redundant systems too, right? I mean, think about it, because other industries, it isn't life-threatening, but in yours, it absolutely is. If a system were to go down mid-procedure, for example, right?
Yes. So the issue of reliability is dominant. And that's why we brought in all kinds of systems, many of them powered by artificial intelligence, in order to, for example, our servers, our switches, we can't afford it to have them go down, even if so a few minutes, So we do a lot of proactive analysis. We throw AI into it to say, server number 398 has had several hiccups, replace it right away. So we don't take that chance. So we've made a huge effort to improve reliability. We've gone from 1.5 to like 98%, up to 99.9% reliability.
Wow.
The doctor requires the technology to be there at all times. Well, one of the biggest problem, I just had a bit of a debate with my ER doctors, because I wanted to bring the system down in order to bring in SD-WAN. Some of you understand what that is. That's big, huge for us. Software defined WAN. And I needed 15 minutes of downtime from my ER doctors, because they want to do it at night, not in the daytime when we got 4,000 patients here, treating every day. I want to do it at night. And the ER doctors told me, nope, don't do it, because when you do it at night, we still have 100 patients in our ED. We can't afford to be down for 15 minutes, even if it's late at night. So
what do you end up doing then?
Yeah, what do you do?
What'd you do?
Oh, well, in this particular case, I went back to the vendor. I'm not going to battle the head of ED. Especially so many of our patients come through the ED. I mean, we do 350 ED patients every day.
Oh my gosh!
Come here. Come here on a Friday, Saturday night. The gang wars around us. You see all the mayhem that dumps in our ED. So we can't be down. Our doctors are stressed tremendously. So in this case, I went back to the vendor, because the vendor says, no, they can't do it. I tell the vendor, do it at 2 a.m. in the morning. And says, we don't do that. I can't do it at 2 a.m. in the morning. Then I said, but I can do it at what other time? So Saturday morning at 7:30 a.m. The ED is quite the Friday night mayhem has abated. I'm down to about 60 patients in the ED. Then they grudgingly says, okay, Ivan, you can have your 15 minutes of downtime. It says, but make sure it's not a minute over 15.
My goodness.
That's the kind of pressures that we're on. So the doctors now using this technology, they require it always to be there.
Ivan, I think it's very important, because if I'm on a table at your hospital, I don't need 15 minutes downtime if the robot's helping with the operation. So I'm 100% on board. I think this is a super important topic. And now I know, don't show up at 7:30 a.m. on Saturdays, because Ivan may be upgrading something. Now
That's
I know
right.
your secret time.
It's only one Saturday out of 26. So you're generally okay. And we'll make sure that that everybody is aware of that.
All right, perfect.
So you had mentioned earlier when you were talking about this specific example, how you work closely with providers and vendors and things like that. You must have some very critical partnerships that help you achieve all these things, right?
We have to have a very close communication process all the time, with especially our senior doctors, our senior nurses. They have to be comfortable. If something happens, they can pick up the phone and either talk to me directly or one of our managers here and get their problems addressed, because they can't wait for the next business day. They can't wait 4 hours. They got a problem, they got to address it right now. There's a patient that may be suffering that has to be gotten to right now.
And do you have provider partners also on standby all the time, like some technology service providers that you have on standby, literally?
For example, a radiologist in the cloud. I mean, at 2 a.m. in the morning, we may have, it's a slow time. We can't afford to keep a radiologist here just hanging around. But, what if the gunshot wound comes in and they got to see did this or did this not touch the aorta, throw a CT CAT scan in their stuff, it's got to be read within 2 or 3 minutes.
Wow.
The patient is bleeding on the operating table, and where is the bullet? How close to the aorta is that bullet? So we go out to the cloud. We have a relationship with several 100 radiologists in the cloud, and we can get it done. Any reading can be done within minutes.
Wow.
That's great. Now you've got a technology I read about Zdesk. Tell us a little bit about that technology and what that's done to help your organization and how you implemented that. You've got a very small organization, obviously very lean organization. So how do you work with a managed service organization?
Well, it's not that small, but we have about 3,500 PCs, computers. We have another about 150 mobile carts here, and people use their cell phones all the time. So we got thousands of devices out there. And part of the problem was that many years ago, these devices, they were not always reliable. I mean, 98, 99% is not good enough. The doctor and the nurse needs it all the time. So I had to improve the reliability. How do I improve reliability? 2 ways. I bring in AI, as I mentioned before. And by the way, I also mentioned that in my case, so 3-4 years ago, all the devices, they were still XPs. You don't have the money to modernize every 3 years. Hey, we're a safety net hospital. So we keep our PC going for 5 or 6 years. We keep our service going for 8+ years.
Oh, wow.
Hey, and you got to do what you got to do. But we got to make that reliable. So how do we make that reliable? I've mentioned before AI. And the second big issue is virtual desktops. Bring in VDI. Who needs a nice big computer anymore? Use a very tiny box. All the processing power is done on this VDI, virtual desktop server. And you improve the reliability of the box at the desk. Has very little in it to fail.
Yeah.
All the moving parts are on that in the data center on that server, from which I can focus and make sure that never fails. I got those 36 servers that I worry about instead of 4,000 PCs.
Wow.
So it's huge improvement in reliability, huge improvement in performance, and those VDI desktops, they're much less expensive than a regular PC. So we save money. We talk about a win-win situation.
Yeah.
So
hey, John,
that works very well for us.
John, you talked about before. We've talked before about this. Is you made some great comparisons between hospitals and hotels, and kind of share that idea of the customer experience, because I thought that was very interesting.
Yeah, no, I think it is a very interesting thing. Right now, especially what's happened over the last 18 to 24 months with every business, including in healthcare, right? It's all about customer or client experience. And you can't get away from that. You really can't get away from that. And, one of the studies that I was involved with over the last couple of years was comparing 2 very disparate industries, like, hospital systems and hotel companies. And people said, God, those are wildly different. It's like, maybe they're not so wildly different, because people have a choice nowadays where they go. I mean, in a lot of cases, if it's a life or death situation, an ambulance is bringing you to a BronxCare facility, that may be a different situation. I don't see a patient sitting up saying, no, I'd rather go there because they have better customer or patient care. Right. But I think when people do have a choice, right, it's all about what the experience is like. And, oh, by the way, everyone tells everybody about their experience. So there's some very interesting studies that have really cross-pollinated what people would, intuitively think were, disparate industries like hotels and hospitals, and how people actually make choices. And it's really not just about the patients making choices, right, Yvonne? It's also about your staff making a choice to be at that facility versus another, or, the doctors, wanting to do procedures there versus another, right? It's not just the patient side, it's also the employee side.
Yeah. Well, on the patient side, we all recognize that hospitals that typically, didn't put a lot of emphasis years ago on the patient, the customer experience. They now had to be more like hotels, where they bend over backwards, in order to do that. And they had a simple solution. The feds came and mandated that we have to give to a small proportion of our patients a survey. And that's the basic question, the old Ed Koch question from a former mayor of New York City: how are we doing? So the feds made us, become closer to hotels, to to achieve that patient experience. Very important also is the physician experience, because these doctors, the physician burnout, they're leaving the industry. They're overstressed, overwhelmed, and this pandemic of the last year and a half has been tremendously stressful to them. So anything we can do to improve the patient experience and the physician experience, and also, obviously the nursing experience, we will do that. And we've done a lot in that area.
Yeah, I mean, Yvonne, definitely, back in 1890 when your hospital opened, none of us were around, obviously, but it was just, you were happy to get to a hospital, period. And so customer experience wasn't too important, but today's world, in the last 16 years that you've been involved with BronxCare, I think that's become a key topic, is employee doctor engagement and the patient engagement, because that experience, they can make some choices. Tell us a little bit about more of the current time. We've been through a very interesting period, third rock from the sun, global pandemic. How did you deal with the global pandemic from an IT perspective and a technology perspective? I mean, tell us a little bit about how you service the hospital and patients and everybody else.
Well, it was exceedingly stressful, exceedingly dramatic here. I mean, I think I mentioned to you already about how our desktop technicians had to make decisions. I don't have PPE. I got to go to that positive patient. Do I go there? Do I not? So tremendous thing. But we, because I'm CIO, but also I think I'm the chief node officer. You can always ask, what can technology do to help? And last year, patients wouldn't come to hospitals, rightly so, unless they were very sick, unless there's a gunshot wound there, But so for routine outpatient care, so we finally moved dramatically into telehealth. We couldn't do telehealth before because the payers wouldn't pay us for it.
Wow.
So it's terrible. But now last year they realized, hey, the only way they get patients to see the doctor, in many cases, is through telehealth. So we launched a lot of telehealth initiatives, and close to 40% of all of our visits in the outpatient area became telehealth. So we were successful. Now it's receded a lot, because and then a year ago people didn't mind. Sometimes they're waiting for the technology to work, but now they do. So now we're striving to make it much more efficient, much more effective, so the doctor can connect to the patient in a few minutes, and have a seamless process in there to help, especially with like follow-up visits. What are ideal? So that's a big challenge now in order to do that. And we also have to address the physician questions, because the physicians are not happy to doing all this typing. How can we help them in order to do that? I mentioned conversational AI, how that can be done. And can we speed up that process to make the doctor more efficient, so the doctor is not as overburdened as they are today?
And maybe we've got that photograph of your team, some of your team there.
Yes.
I think that's pretty heroic. You've had a group on the ground that had to actually maintain systems in the hospital, right?
Right. Yeah. And I mean, it's just an example out of many. I'm looking at the wording done by our physician in chief, Dr. Chili Murray. He came to these folks. I was elsewhere, so at my other hospital now, and he said, "Listen, I got a big problem. We have to go and check on our COVID patients, but every time I go in and out of our room as a doctor, I got to take off all this PPE, put on a whole new PPE. I waste time, and I don't have the time. And the patient may be coding, very serious. Wow. So what can you do?" So this gang that you see here, they said, "Why don't we take the IV poles and put an iPad on them? Nothing, low tech." And put them in the room so the doctor doesn't have to always go inside and go through all the changing process, but they can see instantly. So these guys did it. And 2 hours later, the same doctor came back and said, you just saved a life, because that patient started coding, and we could see it on your iPad, on your iPad phone. And if he hadn't done that, the patient would be dead. So imagine, these people, they go home and say, well, the family says, well, what'd you do today? And I tell them what you did. You saved a life.
Boy, it puts things in perspective, doesn't it, John? Oh my goodness.
It really sure does. It sure does. And it doesn't happen without partners. It looks like you've utilized, I'm looking here at some of the quotes from you and your chairman is, Gav's Long 80s, those are service providers.
Yes, so we use service because retaining qualified staff in New York City isn't easy, I'm competing against banks. So we use a lot of managed services, and it was the managed services that we gave them these challenges, and they came up with these solutions. So we have, I think, a fairly good process in place here at BronxCare.
Wow. That's great. Wow. That's great.
So I have to ask, just because I think that, I was asked the exact same question, John. What is next? What do you see? What is the next big thing coming from your perspective in your industry?
Well, as I said before, and I mentioned, I think sometimes, conversational AI. Get the doctors away from having to type. They hate to type. And as a matter of fact, what they do in the ED is they hire scribes who follow them around, who do the typing. So imagine this: in every other area of computers, you bring in automation, you reduce staff. Not in hospitals, you increase staff. Because of the need for exhaustive typing. And the second thing is that we have to take a fresh look, like version 2.0 of the EMR, because we've created this only, it's only been a few years, as I mentioned, from paper to computers, and we have to go back and really retool that effort to, again, focus on making it much more efficient. But bring in AI, so a lot more AI happening in that regard.
Yeah, I don't think our audience appreciates, I certainly didn't, I always think about doctors and nurses and all of the people at the hospital that make sure that I'm going to be healthy and happy. But there's a lot going on behind the wall that Ivan and his team are doing, and service providers like Gavs that you just don't appreciate when you're kind of on that bed trying to get help. Is there's all that technology, and if it's not working, that's a real issue. So exactly. Ivan, congratulations on 16 amazing years. Looks like you got some ambitions and ideas that you want to bring to the hospital over the next couple of years. So we look forward to kind of hearing more about what you're doing there in the next couple of years.
I'd love to share. And again, I go back to my battle because some of these ideas, unfortunately, they cost money. So it's the eternal battle with the budget. But we're there, and we didn't mention this, but I got to keep my hospital safe from the cyber criminals. It's a whole huge separate topic.
Wow, cybersecurity is like a whole nother show. That would be, that's so interesting, thinking about stealing patient information, how important that would be for you to worry about. That's incredible. All right, well, thanks so much, Ivan. We'll have you back on the show at another time.
We'll bring you back in a couple months. Thank you so much, Ivan.
Thank you, John. Bye.
Thank you.
Bye-bye.
Wow. It puts things in perspective. I mean, I know we all see these television shows that are high drama, but it's not just high drama on TV. In real life, this is like nonstop high stress, not just for the doctors and the nurses and obviously the patients, but also the behind the scenes workers like Ivan and his teams that have to keep these systems up and running, with 5 nines, quite frankly, right?
Well, and listen, he was a little bit humble. BronxCare is one of the underprivileged congressional districts in the United States, one of the most. So it is an incredible, intense environment. And frankly, there's not a lot of money. So he's got to find cost takeout in technology at all times to help make sure that they're servicing that patient. So as they're doing things like EMR, they're also looking, that's going to save money, make things more efficient, because it's an incredibly intense environment. Over 500,000 patients a year. I can't even imagine.
Yeah. Well, when he was also quoting some of the stats of how many people were in and out of the emergency room, like on a Friday or Saturday night, several hundred people in an emergency room. I mean, that's just unreal. I mean, if you think about it, it's like, again, I think I'm embarrassed to say it, but I think that is only in the movies or only on TV, but that's real. That's right. Now, I realize the Bronx is a little bit different than probably, where you live or where I live, but still, oh my goodness.
And the applications, John, of what, Ivan was talking about is across, to your point, is hospitality. It's across cruises and places where experiential things are happening. So I love kind of hearing some of these ideas, because even the EMR and other technology, those are things that could be used in a different application in a hotel or in a cruise line. So it's very interesting.
It is. It
All right, what do we
is.
got
And I
coming
think
up
what it
next?
points
What
to,
do we got coming up
it
next?
points to the fact that customer experience is king. It really is. So
It is
hey, we've
king.
got a couple of really cool shows to close out 2021. I can't believe I'm saying that we're coming out to the close of the year. So in 2 weeks from today, on Thursday, December 2nd, we have our very own CEO, Mike Connors, will be joining us for a fireside chat. We are super excited about having him, John. That'll be a treat for everybody. And then our last show of the season is going to be on Thursday, the 16th of December, right before the holidays. And we're going to have the Field Nation CEO. And boy, that's a very unique model that most people haven't heard about. So you have to tune in and hear about that, because it's something that you probably never heard about. So the next two shows are going to be fantastic. Looking forward
to it, John. And Mike Connors, our CEO and chairman, I mean, firm culture, the way he operates and from the top down, and really helps an organization and build that culture, I think is going to be a really dynamic conversation, especially with how we've come out of COVID as a firm. So lots to learn, I think, from Mike, for sure. And then Field Nation, to your point, I am so energized by that conversation, because what they're doing is really changing, again, goes back to customer and employee experience, and making services so much more dynamic. So looking forward to that show as well.
Me too. So, hey, happy Thanksgiving to you and to all of our listeners. And we'll see everyone in 2 weeks. Take care.
All right, John, eat the turkey. Don't be the turkey.
Absolutely. Absolutely. Take care, everybody. Thank you.
Bye-bye.